Most people assume that if they ever get an STI, a quick trip to the doctor and a few pills will make it disappear. But that's not always true. Some sexually transmitted infections can be completely cured. Others can stay with you for life. And by the end of this video, you'll understand exactly which STIs are curable, which are not, and why millions of people are confused about the difference. What makes this topic so important is that many people don't discover they have an STI until weeks, months, or even years after infection. Some never notice any symptoms at all. Others mistake the warning signs for something completely unrelated. And that delay can make a huge difference. Because when it comes to STIs, knowing what you're dealing with can determine whether the infection disappears forever or becomes something you'll manage for years to come. Let's start with one of the biggest misconceptions. Many people use the terms STD and STI interchangeably. Technically, STI means sexually transmitted infection, while STD refers to sexually transmitted disease. The distinction isn't as important as understanding the infections themselves. And that's where things become interesting, because not all STIs behave the same way. Some are caused by bacteria. Others are caused by viruses. And that difference often determines whether they're curable. Let's begin with the good news. Several common STIs are curable. One of the most common is chlamydia. Chlamydia affects millions of people every year and often causes no symptoms whatsoever. Many infected individuals continue their normal lives without realizing anything is wrong. When symptoms do appear, they may include painful urination, unusual discharge, pelvic discomfort, or testicular pain. The problem is that untreated chlamydia can lead to serious complications. In women, it can damage reproductive organs and increase the risk of infertility. In men, it can also cause complications if ignored for too long. The good news? Chlamydia is typically cured with antibiotics. Once properly treated and confirmed by a healthcare provider, the infection can be eliminated. Another curable STI is gonorrhea. Like chlamydia, gonorrhea can be surprisingly silent. Some people experience burning during urination or unusual discharge. Others experience no symptoms at all. And that's exactly why it spreads so easily. People often don't realize they're infected. Fortunately, gonorrhea can also be treated with antibiotics. However, doctors have become increasingly concerned about antibiotic-resistant strains. That's why early testing and proper treatment are so important. Then there's syphilis, a disease that has existed for centuries. Syphilis often begins with a painless sore that many people overlook. The sore may disappear on its own, creating the illusion that everything is fine. But the infection can continue spreading throughout the body. Weeks or months later, rashes, fatigue, swollen lymph nodes, and other symptoms may appear. Without treatment, syphilis can eventually damage the brain, nerves, heart, and other organs. Yet when caught early, syphilis is curable with appropriate antibiotic treatment. Now here's where things start to change. Not all STIs can be cured. And these are often the infections people fear the most. Let's talk about herpes. Herpes is caused by the herpes simplex virus. There are two main types. One commonly affects the mouth. The other more commonly affects the genital area. Although either type can infect either location. Some people experience painful blisters or sores. Others have such mild symptoms that they never realize they carry the virus. And here's the key fact. Herpes cannot currently be cured. Once the virus enters the body, it remains there. However, that doesn't mean life is over. Far from it. Many people with herpes live completely normal lives. Medications can help reduce outbreaks, decrease symptoms, and lower the risk of transmission. For many individuals, outbreaks become less frequent over time. Another lifelong STI is HIV. And while HIV remains one of the most recognized sexually transmitted infections in the world, modern medicine has completely transformed what it means to live with it. Years ago, an HIV diagnosis was often viewed very differently than it is today. Now, highly effective treatments allow many people with HIV to live long, healthy lives. The virus itself cannot currently be eliminated from the body in most cases. However, treatment can reduce the amount of virus to extremely low levels. In many cases, individuals who maintain an undetectable viral load cannot sexually transmit HIV to their partners. This progress represents one of the most significant achievements in modern medicine. But early diagnosis remains critical. The sooner treatment begins, the better the outcomes. Now let's discuss HPV, the infection that often creates confusion. HPV, or human papillomavirus, is incredibly common. In fact, most sexually active people will encounter it at some point in their lives. Many HPV infections disappear naturally as the immune system clears them. However, certain types can persist. Some strains may increase the risk of certain cancers. Others can cause genital warts. This is where people become confused. The virus itself may not always be permanently removed through medical treatment, but many HPV infections resolve on their own. And preventive vaccination has dramatically reduced the risk associated with several high-risk strains. Let's pause for a moment, because this is where many people make a dangerous mistake. They assume that no symptoms means no infection. That assumption has led countless individuals to delay testing. Imagine a young professional in their 20s. They feel perfectly healthy. No pain. No visible symptoms. Nothing unusual. Months pass. Maybe even years. Then during a routine screening, they discover they have an STI they never knew existed. This scenario happens every day. And that's why regular testing matters. Not because everyone is at high risk, but because many STIs are silent. The absence of symptoms is not proof of absence. Now let's tackle some common myths. Myth number 1. If I have an STI, I'll definitely know. False. Many infections produce little to no symptoms. Myth number 2. Only people with many partners get STIs. False. Anyone who is sexually active can potentially be exposed. Myth number 3. If symptoms disappear, the infection is gone. Also false. Some infections temporarily hide before causing more serious complications later. So what happens if STIs are left untreated? The consequences vary depending on the infection. Some may cause chronic pain. Others may affect fertility. Certain infections can damage organs over time. Some can increase vulnerability to additional infections. The goal isn't fear. The goal is awareness. Because early detection dramatically improves outcomes. The best prevention strategies remain surprisingly simple. Use protection consistently. Communicate openly with partners. Get tested regularly. Stay informed. And seek medical advice whenever something feels unusual. Prevention isn't about fear. It's about taking control of your health. So let's answer the question that brought us here. Which STIs are curable? Common bacterial infections such as chlamydia, gonorrhea, and syphilis can often be cured with appropriate treatment. Which STIs are generally not curable? Viral infections such as herpes and HIV currently have no permanent cure, though they can often be managed extremely effectively. HPV exists somewhere in the middle, with many infections clearing naturally while some may persist and require ongoing monitoring. The most important takeaway is this. An STI diagnosis is not the end of your future. Many infections are treatable. Many are manageable. And modern medicine continues to improve outcomes every year. Your health matters more than embarrassment. If you think you've been exposed to an STI, don't rely on guesswork. Get tested. Talk to a healthcare professional. And take action early, because knowledge truly is power. If this video helped you better understand the difference between curable and non-curable STIs, subscribe for more medically accurate health breakdowns designed to keep you informed, protected, and empowered. And remember, the earlier you know, the more options you have.